Thank you for staying with us on the program. Let's get the first discussion on the road quickly, everyone. The one that has to do with the COVID-19 spike, the one especially that is related to the second wave, and then in between we're talking about the new strain now, which experts are telling us is way deadlier than the previous that we had seen. And this is 2021. Some persons have said COVID will not follow us into the new year, but the conversation is obviously entirely different across the globe, Nigeria not being an exception. At this point, it will appear for the most part, the conversation centers on vaccines and vaccination. And then you're wondering how well or otherwise is Nigeria doing right now, especially as it relates to vaccines. And of course, the need to continue to create awareness and sensitize members of the public as to the fact that not only is COVID real, but they must take responsibility for ensuring that they stick with all of the prescribed protocols as far as this nasty pandemic is concerned. I'm joined by an expert, the chairman of the Nigerian Medical Association here in Edo State, Dr. Harrison Omohua. It's a pleasure to have you come to talk to us on the program this morning.
Good morning. It's my pleasure to be here.
Okay, great. I don't think at this point we still should be debating whether or not COVID is real. So on account of that, I want us to move quickly to what you and your colleagues will refer to as TTTT or something. I mean, the trace test and all of the things you do going forward. Every day you look at the NCDC website, for example, you see samples that have been tested, those that are hospitalized, lab confirmed cases, ones, the casualty figure, and those who have been discharged and so on and so forth. You look at a country like the UK, they are not doing what they call tier 4 restriction. Other countries are in total lockdown and so on and so forth, because it is obviously very necessary they do all of that. Why are we not enforcing lockdown in Nigeria, for example?
Well, thank you so much. It's unfortunate that the issue of COVID has come in with us into the year 2020, 2021,
Right.
and no one expected this. As a matter of fact, when we first experienced COVID in Nigeria, that was February 24th, brought in by a foreigner. February 27th.
That was in 2020?
Yes, 2020. You know, people had hopes that it will soon leave, it will soon leave us. But here we are today, 2021, and it doesn't look like we are going to exit these issues anytime soon with the coming of the second wave, which you have rightly described to be more, I don't want to use the word deadly so that people don't get unnecessarily scared, because one of the problems we have had with this pandemic is fear. You know, the psychological.
Can we not blame part of that on you? I mean, those of you in the medical community?
No. Why? Because we tell the government what is good for the people, the measures to take. It is left for the government to enforce. That's the problem we are having here today. You talk about the issue of lockdown. We had a lockdown for several months last year. To me, if you look at it, it didn't help much, because the problem we have here in the country is we tend to import ideas, we tend to import activities in other climes into the country without thinking of the peculiarity of Nigeria. It doesn't work that way. You look at your own setting, you look at the other clients, what happens there? What are the things on ground if you are going to lock down? What are you providing for the people? How are you expecting the people to cope with a lockdown? When we have heard severally about how very poor the country is in terms of economics and how people survive, people will revolt. It won't work, except we are not serious, except we are playing politics. Now we need to be realistic in approaching this pandemic. Look at it holistically, and then look at what are the vulnerables. Because if you want to say lockdown, people will revolt and it won't work. You won't get the result. You are going to still have increased. So what do? Enforcement. We think government needs to enforce these non-pharmacological methods of preventing it, of preventing COVID.
Wear your mask, wash your hands,
social distance and all of that. It is not, to me, lockdown won't work. It won't work. That is the truth.
A lot of persons are now saying, I'm sorry to bump in, that lockdown probably was not so effective, to use your word, in 2020, because for the most part it was staggered. I'll give you an example. They're saying in one state you have a total lockdown where they don't even allow travelers to come into the state, for example. In other states, you have more like a curfew between certain hours at night. So they are saying it should have been countrywide. So whatever policy you are implementing and enforcing in one state should be replicated across all the other states in Nigeria. But my mom would say all fingers are not equal. So we're dealing with the reality that we had in front of us at that time, were we not?
Yes. But is it lockdown works when the government has planned the lockdown properly.
Okay.
You have put in place what these persons you are going to lock down, how are they going to survive? Let's be realistic. I like to be very realistic when dealing with public issues like we need to be very realistic. How will the people survive? You may lock down for 1 or 2 weeks, people survive on the little reserves they have, but thereafter, what happens? For you to be able to achieve meaningful results with a lockdown, you are talking about lockdown for months. How will Nigerians cope? That is the truth.
A lot of persons have been pointing out now to the issue of traveling. We understand, at least so far on records, that the Nigerian authorities have confiscated 100 passports of travelers who we are told had flouted the COVID-19 protocols. We're told that's the way to go, ideally, given this the gravity of this pandemic that we're dealing with.
Yes.
But some people are also saying that we didn't swing into action early enough upon getting the news of the second, the new strain now, which we are told actually came from South Africa. And at that point, you would hear that flights were not allowed from South Africa into London, for example. Flights from London were not allowed into New York or anywhere in the US, and so on and so forth. In the middle, what was Nigeria doing upon getting that news that there was now a deadlier strain?
The usual thing. Politics, not wanting to. That is a problem with the country. I'm sorry to say, the leaders, the government, they usually dilly-dally, and at the end of the day, they wait for the last minute to act. Even when it is clear that the NCDC would have given the advice from their own perspective of what to do. Other countries, even in the first wave, it was the same very slow approach that we had until we started having persons who were immigrating, were coming in with the virus. Now the second wave, we heard about, as a matter of fact, we started hearing about the second wave happening in, South Africa first, then other places. That's where we should have acted. That's when we should have been more stringent with the immigration rules and all of that, which of course didn't happen until, of course, it came to us and it started spreading here right in our country, and people are now using a fire brigade approach, trying to see what can be done when it has.
I want to take you back. I want to take you back quickly, because this is vital to this conversation. We are told, by and large, this virus emanated from Wuhan, a city in China. And just today, for example, news is reporting that in the last 8 months, China has only recorded 1 death.
Yes.
From COVID. Help me make sense of that.
Well, like I said at the beginning of this discourse, I said there's need for us to know what works for us. China has looked inward. They have looked at it critically, and they have done their own research. For instance, yes, they did. One of the reports I saw from China was the fact that there were a lot of non-pharmacological means of trying to prevent or trying to kill the virus by taking steam and all of that, taking steam and hot water. That was a report I heard from China that was working for them. Now, have you looked at China, and you would have if you have looked at China recently, you have noticed that you could hardly find anybody not wearing face masks. Just find out. Go and find out.
It's a popular practice amongst them.
It's a popular practice. It has become a norm for people to wear face masks. But what happens in Nigeria? It's totally different. Government sees what is going on. Now they look the other way, as if they don't know what they say, look, we need to be serious. If we are not prepared for this, we tell ourselves, enforce the use of face masks. Go to the market, the popular marketplaces. People don't even believe. That is one of the greatest problems we are facing in the health sector. A lot of persons do not believe, even some educated, a lot of educated persons do not believe that the COVID exists.
The government has given them basis not to trust over time, so that's what's rubbing off. But I want to take away from that. Now, you have mentioned markets, the open markets, as we know them, for example. There have been questions as to how do you try to regulate churches. Now, we're even told that in certain places, you're not supposed to have more than 50 persons in a church. And then you leave the markets to run the way they do with all of the interactions and clustering that we find in our open traditional markets. And they're wondering, upon what basis do we have that disparity? I mean, churches, it's even easier for you to tell people in church, wear your mask, I mean, spread out and so on and so forth. But that's going to be a hard nut to crack if you need to replicate that same method or measure at an open market. So why are we, quote unquote, regulating churches and we can't do the same with markets?
That's the point here I'm trying to make here. Why has government not tried it? I can't remember the government sending the enforcers into the marketplaces to ensure that these are done. Why can't you shut a market if you find out at that particular market there is no compliance with the use of face masks? Look, the truth is, social distancing I like to be very realistic with our own place, with our own. Social distancing, from what I've seen, maybe difficult. But use of face masks, it is not. It is not. You can get close to somebody, both of you are wearing face masks, without actually maintaining the social distance, and the chances of you contracting the virus is very low.
Slim.
It's very low. So what is there in enforcing, government enforcing faith? The other day I heard on the news that government will soon start to prosecute those without face mask. I got a little happy, but in my subconscious, I knew that it was the same old political talk that we have been used to by this government. And today, people don't use face mask. You go to occasions, you attend activities, and go to market. People don't use face mask. And government vehicles, government agents, they are passing through these places and nothing is happening.
Let's talk about vaccines and vaccination, because that's where we are now across the world. Is Nigeria playing catch up with vaccination?
It's unfortunate that something that is meant to actually save people over here, especially in Nigeria, we seem to be joking with it, the issue of vaccines. And we are asking questions if we should bring in vaccines or not, if we should accept vaccines or not. And most of these problems I blame on the social media. Because it's very easy for anybody to sit down, craft up something, and you upload into the social media handles, and people start to you see, this is not the first time where we have had to face pandemics like this, and vaccines came to the rescue. And there were no controversies on whether to accept or not. Because if you remember that in those days, the social media awareness was quite poor. So it was easy for persons to go through with instruction on how to receive vaccine. But these days, there's a lot of fear put in by the social media. What is vaccines? Vaccines are simply things that help you to build your immunity, to be able to recognize a particular disease when you are exposed to it, and your body builds the natural immunity, the antibodies to fight that particular disease. And they are supposed to help. And vaccines are not just given. They are drugs that have passed through the necessary clinical trials for them to. So I'm shocked that up till now Nigeria is still not certain, as far as I'm concerned, about bringing in vaccines, about what to do with vaccines when the other crimes, almost 30% or 40% of their population are receiving the vaccines.
Go ahead.
I think the major issue here is because we have not, and God forbid we don't get them, we have not witnessed the kind of mortality that is happening in other climes. A lot of persons are saying, I want to receive vaccine because probably in their own family, nobody has died of COVID. I've had persons, I work in a hospital, I've had persons who have died. Somebody died yesterday, very close to me, who have died from the COVID issue. So that is why you see that persons are saying I won't take the vaccine, because what is happening in the US, in Europe, and is not over here is not as serious. If not, there shouldn't be. If the vaccine has gone through the necessary clinical trials, I don't see any
approval.
Yes.
You know, some states in Nigeria now say, I mean, we're hearing that some states in Nigeria, including Lagos, would rather place orders as individual states for vaccines, and then you have states on the other hand, including Cross River, for example, they're now complaining that they are not comfortable with the sharing formula of the vaccines. Do you think politics is already creeping in or is already resident in the conversation?
Well, the truth is when you have to share something like this and you have to distribute. See, distribution was one of the things the expert projected might be an issue with the vaccines.
Even in the advanced countries?
Yes, it was one of the issues which they projected, and they foresaw that it may be an issue. But they decided to look at the population and said, look, we're going to have to share the population into different categories based on the vulnerability of such persons. And so they looked at and said, look, if you are having in a particular state, for instance, or in a particular region where the pandemic is so high, why don't you start from a place like that? Or for instance, you look at the healthcare workers. You said these are persons who most times come directly in contact
very
with
exposed
yes, very exposed. So why don't we start from this group of persons, so that at the end of the day you are trying to ensure that those who are at higher risk or more vulnerable are taken care of, then you gradually go the other way. To me, I do not want to say there's politics here. I think it is when something is not available for everyone, you try to see how much you can make do with what you have. By taking care of. I think that's what's going on. I don't want to say there's politics.
When you listen to commentaries by doctors across the world, especially in the West, global West now, some of them are beginning to sort of cast a shadow of doubts on the efficacy of this this strain, the new strain. I mean, efficacy of the vaccines now, especially against it. Exactly. What have been your thoughts about that?
Yes, you see, when you produce vaccines. When you produce vaccines, it's actually targeted at a particular disease, at a particular infection. That is the truth. That is how it works, because even in our immune system, our natural immune system, what we refer to as the soldiers of the body, the antibodies in our system, a particular antibody is not effective against different types of diseases. You understand? So it targets one type of disease. So when vaccines are made, they are made to target a particular virus. So once there is a change, meaningful change from that particular virus for which it was made, it may not actually be sensitive, may not actually be effective against it. It is not a foregone conclusion for now that the vaccine is not effective. There are fears being raised by experts, which is normal in any developed society, that this may not work. When you know the mechanism of action of a particular drug, you know exactly what to expect when you start to use the drug. So that is what people are scared of, really. And really, how much of this second wave caused by this new strain have actually been determined in our own climate, to say this particular person, these samples we've tested today, this particular person has the initial strain, or this one has the new strain. So those have not actually been done. Those are critical issues you need to put on ground. And you say, look, let us try it on this person and try it on this person. Will the people having these two different strains, and see whether the vaccines will work. In any developed societies, you should be able to think ahead of what next. Those are normal issues. That people are saying that whether it will work or not. I think the first thing is, if the vaccines are available, let us begin to use them as long as they have been certified safe for human consumption. That's my point.
Let's look at what we are now calling herd immunity. I'm sure you're very familiar with that. Dr. Fauci, Anthony Fauci in the US would always talk about herd immunity. I wouldn't know whether that has peculiarity to maybe a region or something. What kind of conversation should we be having, whether as medical experts or everyday people, about herd immunity in Nigeria?
Yeah, the herd immunity, you see, what herd immunity simply means is that you are allowed to be exposed to a particular disease, a particular virus, and then your system, your natural immune system, is now allowed to fight it without any
independently.
Yes. and hoping that in that process, your body is able to produce what we call memory, some memory cells. So their function is to ensure that if that same disease comes next time, the body is already aware of how I fought it the first time I was exposed to it. So this time around, the body is quicker to react to it. So you already have formed antibodies. So that is what, but it's just something that, unfortunately, not everybody's immune system is strong enough to be able to deal with this. So if you are talking about herd immunity, it means that you have to necessarily sacrifice some persons who may not be so lucky to have such
some of them maybe even with underlying ailments.
Exactly. So herd immunity is, to me, is just a decision you need to take and say, look, some persons we have to go. So let's. I don't think it should be a sole means or way of dealing with a pandemic, personally, because you don't know who really is going to fall.
Okay, I want to drag you into a bit of politics here, even though we're talking health issues, because they are interwoven at some point. The PDP, of course, the opposition party at the federal level, is not saying that the PTF should be, as it were, cancelled. That is the task force on COVID.
Yes.
Presidential task force. Yes. Should be cancelled because, according to them, they are not effective. They are not serving the purpose for which they were even set up. But then again, you look at countries across the world, including the US, for example. They have their own task force on COVID at a point led by Dr. Anthony Fauci and so on and so forth. Are we just having a circle of people sitting and giving us figures and telling us what's happening with COVID, or are we having a task force that really is down to business, from your standpoint?
The truth is, when you have an organ or a body set up in a country like Nigeria, you certainly expect to have some Nigerian, attributes in it. That is the truth. Let's not deceive ourselves. So what that means is that you have Nigerians heading that task force, and I do not expect that we some level of politics has not come into this. And sometimes there are things that happen that you begin to wonder what really is going on. For instance, I don't know if you listened to the Dr. Bello's interview. Yaya Bello,
Kogi State Governor.
Yes, Kogi State Governor. And the issue of this pandemic and the people of Kogi who have actually recorded about the lowest in the country.
Sometimes they don't even pop up in the figures by the NCDC.
Yes. So sometimes you try to marry. You need to actually be a part of that task force to know exactly what is going on there. You need to be a member to be able to see exactly what is going on there. But the activities, sometimes when you try to juxtapose what is happening, what they are doing with what we actually see, yes, you have a reason to say something is not quite right about the task force, as far as I'm concerned. To me, if you are dealing with a system, you are dealing with something, and you appear not to be getting the desired results, sometimes there is need to change.
Now that you brought in Yaya Bello, Kogi State has not been visible, for want of better words, as far as this pandemic is concerned. In fact, for months, you don't even see Kogi pop up.
Exactly.
As if Kogi is not in the radar. What can we logically say is responsible for that?
Honestly, sometimes that is why I said that there are some areas in this pandemic, some issues in this pandemic that because there are persons who travel out of Kogi. There are Kogi persons who leave Kogi to other states and return to Kogi.
Right.
So what is happening?
In between which they would have interacted, met with people.
What is happening? There was a time it actually became a topical issue that Kogi wasn't allowing enough testing to be done.
And the man has never hidden his misgiving about
the COVID
issue.
He keeps saying it. And can you blame the man? He has facts to back it. So that's why it's very difficult. And there, I expect really the NCDC to come up and say otherwise about the claims of the Kogi.
With superior facts.
With superior facts. That hasn't happened. So you can't blame the man. The man keeps talking. He has the facts on ground. So things like this, when things like this come up, it casts some doubts and some misgivings about.
Dr. Harrison, I'm going to let you off in 2 minutes, but not until I've asked you this on the final note. Doctors like yourself would say we shouldn't be unrealistic and have, have our heads in the clouds, thinking that this pandemic is just going to, we're just going to wake up tomorrow morning and the pandemic is out of our way. In fact, some of them are now saying that we will have to be patient to wait it out. Is that your position on this?
Yeah, you see, realistically, yes. With the way we are going, and of course, except we begin to talk to ourselves as individuals. The work is not for the government alone. We need to realize, we need to begin to tell ourselves the truth as individuals, as citizens of this country, that this pandemic is real, the virus is here with us, and then we need to do our bit to be able to prevent it. If not, the truth, the honest truth is that we're going to have to deal with it for some time, without sounding,
pessimistic, I guess.
Pessimistic and the rest.
Okay, Doctor, thank you for coming to share your professional thoughts on this matter this morning. We'll make efforts to drag you back in here every once in a while to update us on the developments as they unfold.
Anytime.
Okay.
My pleasure.
All right. I've been talking with Dr. Harrison Mohoa, is the state chairman, that is Edo State chairman of Nigerian Medical Association. Coming up next, we'll be looking at not just the academic staff union of universities, but the fact that schools are probably not resuming anytime soon, especially the universities across this country on account of the COVID narrative that is right in front of us. I'll be talking about that with somebody who is an insider as far as ASU and the university community are concerned. Stay with me.